Well, it's obviously unprecedented volume that we're seeing in some categories going through the essentials customers need, and unprecedented sales collapses in non-essentials discretionary items. You can clearly see that the consumer is focused on the essentials to get them through this crisis.
Let's talk about toilet paper. Did that take you by surprise?
Absolutely. We've never seen anything like this. The toilet paper is not something we understand. It's caused hundreds and multiple % increases in toilet paper. There's a certain degree that you would expect people to purchase certain things because of the frequency. Hand sanitizer, they're cleaning more often. That would be a natural thing you would see. But the toilet paper is simply hoarding, I think, is what's going on.
So, besides toilet paper, I asked Mahlman what else has surprised him.
I would say that something like the payment methods weren't something that we anticipated. We're seeing a dramatic increase in Visa, MasterCard, American Express use. We don't know if that is because consumer budgets are tapped out and they're needing to purchase their essentials on other things, or if they're worried about touching money. We're just not clear. That would be an example of a surprise. We're a little bit surprised that it took a while for things like pet supplies and diapers to catch up with the madness around toilet paper, but that's definitely something people are thinking about now.
Now, you mentioned this earlier, that products that aren't being considered as essentials or must-buys by the public, you're seeing sales of those drop right off. Tell me more about that.
That's right. It's very clear that the public is spending all their money right now on purchasing essentials, and anything that is discretionary, like a big screen TV or a consumer electronic item, well, I've never seen sales declines like that. And I think when you look in the retail landscape, you're seeing a lot of stores close, in part to support the government's orders of the spread of the disease, but also a real dramatic impact on those discretionary item retailers.
There is a lot of panic out there, and some of this panic, I think, has to do with people worrying that, places like your chain are going to run out. What do you say to those people?
Well, first of all, the government's federal, provincial, municipal, and industry trade associations have never worked more closely together. Federal ministers are calling directly, provincial ministers are working with agencies. We're passing on best practices and ideas to make sure that Canadians can be assured that they will get through this and there will be goods for them to make sure that they're fed well and taking their prescriptions. There's no shortages in the supply chain if we're only consuming what would be reasonable in these circumstances. The supply chain will and is catching up to backfill those sudden urgent demands of hoarding, and we're not seeing anything that's causing us long-term concerns at this point.
And what about staffing concerns? From the warehouse to the stores, how are people holding up?
I know that our employees are tired. They're working relentlessly. They're working through some very difficult customer interactions that aren't as patient in the store. And they're afraid for their own families because we are an essential service and there's public. They're worried about their own health. Could the next customer make them unwell? But everyone's just been amazing at pulling together, understanding these aren't perfect times, and really rallying on the customer's behalf.